Zimbabwe's government has identified the COVID-19 variant first detected in India in one of its new cases. The person had traveled to India and returned to Zimbabwe at the end of last month. The case was registered in the Kwekwe region, which is a high transmission area. Government has imposed stricter travel restrictions. To tell us more, we are now joined by our SABC correspondent, Ephert Musekiwa. Ephert, good evening and welcome to the show. It is, today is the 19th of May and this person traveled back towards the end of last month, and this detection only happening now. What can you tell us?
Okay, good evening, Audrey. Yes, indeed. The person traveled back to Zimbabwe on the 29th of April. But what we got from the Ministry of Health is that they've been conducting, because when the person returned, the area which the person has been residing, there has been an outbreak within that specific area. They're saying it's a focused area where now, because of that outbreak, they then had to do some genome sequencing to determine if it is indeed the Indian variant, of which the results have indicated that it is the variant that first originated in India. And the restrictions that the government has pronounced following this are quite stringent. Some of them include that anyone returning to Zimbabwe from India has to be mandatorily quarantined at their own expense. If you are traveling from India, you have to bring in a PCR certificate or a PCR test, which is not more than 48 hours. If you do not, you will have to go under mandatory PCR testing at your own expense as well. So it is really trying to dissuade people from traveling between India and Harare and Zimbabwe.
Well, thank you so much, Ephert Musekiwa there, our reporter joining us from Harare.